The Carceral Cage: How Police Violence Fuels BC's Toxic Drug Crisis and Destroys Communities. 1. Introduction: The Deadly Illusion of Policing Safety in BC's Drug Crisis. British Columbia is dying, and the sirens are not saving us. In 2016, the province declared a provincial health emergency. Nearly a decade later, 16,000 lives have been lost, not to addiction, but to state-sanctioned abandonment. In 2023 alone, more than 2,500 people died from toxic drug poisoning, making it the leading cause of death for those aged 10 to 59. Let that settle in. More than cancer, more than heart disease, more than suicide. This is not a drug crisis. It's a policy-induced slaughter. And while communities cry out for safe supply, housing, and healing, the state answers with boots, batons, and body bags. Policing is not public safety. It is not harm reduction. It is a weaponization of colonialism, repackaged in Kevlar and dispatched under the banner of intervention. Every police raid on a tent city, every arrest at an overdose prevention site, every forced displacement of someone trying to survive on poison supply is not an accident. It is a calculated response by a carceral system built to contain, control, and erase the most marginalized: Indigenous people, drug users, and the unhoused. This episode exists to obliterate the lie that the justice system saves lives. It doesn't. What it does is flood communities with trauma, rupture trust, and pave the path to death with sirens, shackles, and silence. It incarcerates pain instead of healing it. It reinforces stigma instead of dismantling it. It manufactures criminality out of survival and then calls that justice. We are done asking nicely. This is a full-scale indictment of the carceral response to BC's toxic drug crisis, an exposure of the machinery that profits off suffering, props itself up on colonial myths, and calls it order. This is a refusal to let police violence be mistaken for care, a refusal to let the criminalization of drug use be normalized as treatment, a refusal to let Indigenous lives be disposable casualties of whitewashed policy. We will name what the state refuses to. The system is killing us, and we are not going to let it get away with it. 2. Historical context: colonialism's blueprint for criminalizing Indigenous bodies and substance use. The toxic drug crisis didn't begin in alleyways or encampments. It was engineered in the architecture of colonial violence, centuries before fentanyl ever touched our streets. The deaths we're witnessing today are not random, not accidental, not isolated. They are the direct continuation of Canada's original project to dominate, displace, and disappear Indigenous peoples. From the moment colonizers set foot on these lands, Indigenous ways of life were criminalized. The potlatch was outlawed, our languages were forbidden, and our children were stolen. Residential schools didn't just aim to kill the Indian in the child, which is their words exactly. They sought to eradicate entire generations through forced assimilation, abuse, and cultural genocide. The state simply changed their tactics. Welcome to the Millennial Scoop, a modern-day sequel to residential schools where thousands of Indigenous children were ripped from their homes and placed in foster systems that mirrored the same racist hierarchies. I know because I lived it. At 7 years old, I was displaced by a state that claimed to protect me, yet left me rootless, voiceless, and alone. This is a blueprint that paved the way for today's carceral responses to drug use. Indigenous people were never meant to survive these systems. We were meant to be erased by them. Policing, courts, jails, these are not institutions of justice. They are colonial control mechanisms dressed up in legalese and bureaucracy. Their true function? To punish poverty, regulate trauma, and erase resistance. Indigenous people who use drugs sit at the bullseye of this machinery, targeted not because of what we've done, but because of who we are and what we represent. Survival in a system built to extinguish us. The rhetoric of law and order is not neutral. It is a cover for the ongoing genocide of Indigenous people, now carried out not with residential schools or Indian agents, but with sheriffs, social workers, and paramilitary police. Every overdose death that could have been prevented, every Indigenous life lost in custody, every child apprehended from a parent using substances is part of the same story, a story of systemic annihilation masquerading as care. The criminalization of substance use is not about safety. It's about power. It's about who is allowed to live freely and who must suffer, be surveilled, or disappear. And until we tear out this system by its colonial roots, no amount of policy tweaks will save us. We don't need more reforms. We need reparations, resurgence, and the return of our right to heal on our own terms. 3. Police violence as a public health crisis in BC's toxic drug environment. Let's call this what it is. Police violence is a public health crisis, and in the context of BC's toxic drug supply, it is pouring gasoline on an inferno already out of control. Study after study confirms what frontlines communities have been screaming for years. Where police show up, people die. Raids, arrests, and surveillance don't reduce drug use. They increase overdose risk by forcing people to use faster, alone, in hidden places where no one can revive them. These aren't unintended consequences. This is a state-sponsored death by design. Ask anyone surviving the streets of Nanaimo, the downtown east side, Prince George, or Surrey. When cops move in, it's not safety they bring, it's trauma. Officers storming overdose prevention sites, tearing down encampments with no warning, dragging people out of their tents like trash. This is psychological warfare waged on the poor and the poisoned. Imagine trying to inject safely, to breathe, to survive, and then watching the few places where you could access care, naloxone, or non-judgmental support become crime scenes patrolled by armed officers. This is not harm reduction. This is harm multiplication. The data doesn't lie. Police crackdowns displace people from supervised spaces into alleys and abandoned buildings. Fear of arrest leads people to rush injections, skip vital safety steps, and avoid calling 911. Disruption of encampments destroys community-based overdose response networks that save lives every single day. These violent interventions are not isolated incidents. They are orchestrated strategies to criminalize survival. Under the guise of cleaning up the streets, we are dismantling the very systems of care that keep people alive, and for what? So municipalities can sanitize poverty from public view? So police budgets can balloon while community organizations fight for scraps? The paradox is glaring. More policing equals more death. More crackdowns equals more chaos. And more surveillance equals more suffering. The presence of police does not deter drug use. It destroys the conditions where healing could begin. It breaks trust. It re-traumatizes people already living with the weight of colonial violence, intergenerational trauma, and institutional betrayal. This isn't just a policy failure. It's a moral collapse. Public health cannot coexist with militarized policing. Harm reduction cannot thrive under the boot of criminalization. And no community can heal when those sworn to serve and protect show up to control, displace, and bury the evidence of a crisis they helped create. Until we treat police presence as a vector of harm, not help, we are complicit in prolonging this death march. The evidence is in, the harm is real. The time for polite dialogue is over. We need abolition, not appeasement. We need care, not cages. We need to decriminalize survival and criminalize the systems that make survival a crime. 4. The carceral cycle, arrests, jails, and the illusion of rehabilitation. The justice system does not rehabilitate. It recycles pain. It chews people up, spits them out, more traumatized, and calls it justice. In BC's toxic drug crisis, jails are not neutral spaces. They are trauma factories where suffering is silenced behind bars and labeled correction. Let's strip away the illusion. Every time someone who uses drugs is arrested, processed, and jailed, the system pretends it's offering a path to recovery, but what it's really doing is burying the problem deeper into the bodies of the criminalized. There's no healing in a cell. There's no dignity in a jumpsuit, and there's no safety in steel and concrete. What does incarceration offer? Cold turkey detox without medical support, a sanctioned form of torture. Withheld access to safe supply, risking deadly withdrawal or post-release overdose death. Isolation from community, family, and culture, erasing the very connections that ground recovery. This isn't rehabilitation, it's institutionalized relapse. And still, the lie persists that treatment offered inside these walls is better than nothing, that people should be grateful for the chance to get clean behind bars. But this logic is colonial at its core. It says, we will help you, but only if we first cage you like an animal. Treatment that is coercive is not treatment. It's state control wearing a therapeutic mask. Programs in carceral settings rarely center lived experience, peer leadership, or indigenous healing practices. Instead, they pathologize pain, punish relapse, and force people to perform success for parole boards and social workers. If you resist, question, or fall apart, you're non-compliant. You lose your privileges, your access, and your chance at parole. The cycle is relentless. Number 1, you're arrested while homeless and using drugs. Number 2, you're criminalized for surviving poverty and pain. Number 3, you detox in a cage with no supports. Number 4, you're released with nothing, no housing, no connection, no safety. Number 5, you use again to cope. Number 6, you're arrested again. That is not failure. it's the plan. The carceral system survives by manufacturing recidivism. It thrives off revolving doors and broken bodies, and when it offers help, it does so on its own terms, not yours. Healing is not possible under surveillance. Wellness cannot grow in environments built on punishment. Real rehabilitation requires freedom, not force. It demands culturally grounded, peer-led, community-rooted responses, not cops in cages. People who use drugs do not need to be fixed by the state. They need to be respected, resourced, and restored by systems that understand lived experience is not a liability, it is a leadership credential. Until we dismantle the carceral complex and invest in community-led, culturally safe pathways to wellness, we will keep mistaking trauma management for justice. The system is not broken. It is functioning exactly as it was designed, to punish the poor, silence the addicted, and erase the indigenous, and we are done pretending otherwise. 5. Systemic racism and discrimination in police and judicial responses. There's nothing accidental about who ends up in cuffs, in courtrooms, or in coffins. In British Columbia's so-called response to the toxic drug crisis, systemic racism is not a flaw, it is the engine. Start with the facts. Indigenous people make up less than 6% of BC's population, yet account for over 30% of the incarcerated population. Indigenous women are the fastest growing prison demographic in Canada, a direct result of criminalizing survival, poverty, and trauma. Black people in BC are 5 times more likely to be stopped and searched by police, despite no evidence of higher crime or drug use rates. In drug-related cases, racialized individuals face harsher sentencing and are less likely to receive diversion or treatment-based alternatives. This isn't bias. This is a strategic containment, an intentional policing model rooted in colonialism, built to surveil, control, and dispose of racialized lives under the pretense of public safety. The interaction with the criminal justice system adds weight to the chains of oppression. From the moment of contact, whether it's a street check, a raid, or an arrest, Indigenous and Black communities are over-policed, overcharged, and underprotected. Systemic racism is a crisis beneath the crisis. It determines whose pain is criminalized and whose is treated. It decides who gets trauma-informed care and who gets a baton to the ribs. It shapes how the media talks about overdose deaths, a tragedy when it happens in a suburb, and a statistic when it happens in a tent. And while the state parades around empty gestures, diversity training, cultural competency workshops, reconciliation statements, the real violence goes unchecked. These superficial programs do nothing to stop the harm. You cannot decolonize a badge. You cannot reconcile while still raiding sacred spaces, destroying encampments, and dragging Indigenous bodies through the courts like we're back in the days of the past system. Let's be brutally clear. A police force that brutalizes the poor is not culturally competent. A judge that sends a young Indigenous man to prison instead of a treatment program is not trauma-informed. And a system that calls itself fair while feeding off colonized, racialized suffering is not broken, it's premeditated. This is not just about bad actors, it's about a blueprint, a white supremacist legal architecture designed to preserve power by criminalizing pain. Until we dismantle these structures and reimagine public safety as something rooted in community, culture, and care, not coercion, we will continue to bury our people while the system pats itself on the back for handing out another pamphlet. This is genocide in a new uniform, and no workshop, no token hire, no PR stunt can wash the blood off those hands. 6. The police state versus peer-led and Indigenous-led solutions, a battle for humanity. This is not a policy debate. This is a war for survival, and we need to stop pretending both sides are trying to save lives. On one side, we have the police, a militarized colonial machine fueled by control, punishment, and surveillance. It responds to grief with handcuffs, to overdose with sirens and raids, to community with displacement and brutality. The system doesn't just fail people who use drugs, it kills them. On the other side, we have peer-led and Indigenous-led solutions grounded in cultural safety, lived experience, trust, and truth. These aren't alternatives. These are the frontline resistance to a genocidal system. They are the heartbeat of communities that have been left to die. What the cops call chaos, we call connection. What the state calls disorder, we call survival. And what they criminalize, we care for. Peer-led harm reduction works because it's built by those who've been there. It meets people where they are, no judgment, no punishment, no conditions. It's clean rigs and naloxone, yes, but it's also eye contact, warm food, and a name remembered. A story heard, a second chance, and then a third and a fourth, because we don't give up on our people. Indigenous wellness models go even deeper. They address not just substance use, but the colonial trauma beneath it. They offer land-based healing, ceremony, language, kinship, medicine that the carceral state has never understood, let alone respected. These practices don't just reduce harm, they restore humanity. The numbers don't lie. Supervised consumption sites reduce overdose deaths. Peer-led outreach builds trust where police destroy it. Indigenous-run detox and healing centers have higher retention and lower relapse rates. Community-led safe supply projects keep people alive long enough to find a future. Yet where does the money go? To police budgets bloated with billions, to more boots on the ground, more guns, more surveillance cameras, all while frontline programs scramble for scraps, forced to justify every penny while the state bankrolls its own violence without question. We are done begging for crumbs while they feast on our bodies. It is time to defund death and invest in life. Not just in theory, but in action. We can redirect funds from law enforcement into peer-led housing, harm reduction, and safe supply. We can permanently replace cops at overdose prevention sites with trained peer responders and community care teams. Fund Indigenous-led healing spaces that aren't bound by colonial frameworks or clinical constraints. Stop criminalizing poverty, homelessness, and substance use and start addressing them with the dignity and resources they deserve. This isn't about reform. It's about a full redistribution of power. It's about ending the war on our people and funding the future we've already started building. Because every dollar spent on policing is a dollar stolen from the solution. And every minute we waste pretending the system can be fixed is another life lost. We know what works. We've always known. Now get out of the way and let us save each other. 7. Call to action, dismantling the carceral drug war and building justice-centered healing. We don't need better cages, we need liberation. This is a moment to confront the brutal truth. BC's response to the toxic drug crisis is a carceral disaster, propped up by fear, racism, and colonial logic. Every overdose death is not just a tragedy, it's a policy failure, a deliberate outcome of a system that punishes trauma and criminalizes survival. Policing does not save lives. Prisons do not heal pain. Courtrooms do not restore dignity. What we need is nothing short of a revolution in how we respond to substance use, a complete dismantling of the carceral state in favor of justice-centered, culturally grounded, peer-led healing. We should be demanding immediate defunding of law enforcement and redirection of those billions into Indigenous-led healing lodges, land-based programs, and peer-run overdose prevention sites, housing models, and safe supply. We should be demanding the end of police presence at harm reduction sites, encampments, and shelters. We should be demanding the abolition of mandatory treatment orders and coerced recovery through the courts, a modern twist on forced assimilation. We should be demanding the return of sovereignty to Indigenous communities to design, lead, and control our own health systems, our own justice responses, our own futures. We're done with consultation that extracts our trauma and gives nothing back. We're done with token seats at tables built to maintain white supremacy. We're done being statistics in their reports while they ignore our solutions. Real change starts with lived and living experience. It starts with truth tellers, not title holders, with culture keepers, not policy people, with people who've survived the system and are now building something beyond it. This is a call to policymakers, funders, service providers, and so-called allies. Stop tinkering with the machinery of oppression and start tearing it down. Stop pouring resources into the very systems killing us and start listening to the communities that are already saving each other without funding, without headlines, without backup. If you claim to care about justice, then prove it. Throw your weight behind co-created policies rooted in healing justice, cultural safety, and radical love. Support community autonomy instead of colonial control. Fund Indigenous sovereignty, not incrementalism. Because here's the truth. We don't need permission to survive. We need you to stop standing in the way. This is not just about policy. This is about life or death. And we choose life on our own terms, in our own hands, and without their chains. 8. Conclusion. Reclaiming life beyond the cage. Here's the final truth I'm going to share with you. Raw, unfiltered, and impossible to ignore. As long as BC clings to the illusion that policing and incarceration can fix a health crisis, people will keep dying. Every police raid, every jail sentence, every forced detox, every budget increase to law enforcement while communities starve for support, it all tightens the grip of a system built to punish the poor, erase the traumatized, and disappear the Indigenous. This is not a broken system. This is a perfectly functioning architecture of control designed to cage the consequences of colonialism, not confront its causes. And yet, across this province, a different future is already being born in the hands of peers who've survived the system and are now rewriting its terms. We've seen what works. Peer-led harm reduction rooted in dignity, not surveillance. Culturally safe spaces that hold trauma with care, not judgment. Community-led healing that rejects punishment and builds possibility. These are not experiments. These are proof of life, evidence that when people with lived and living experience lead, healing is not just possible, it's inevitable. This crisis doesn't need more cages, it needs courage. It needs radical trust to shift power away from cops and courts and into the hands of communities. It needs sovereignty over our own health, our own land, our own futures. We are not statistics. We are not criminals. We are the architects of a world beyond the cage. The carceral era is collapsing. The era of peer innovation, cultural reclamation, and justice centered healing has already begun. It's time to stop managing death and start investing in life, reclaimed, redefined, and led by us.